Welcome back. Let's go ahead and review some cardiac medications. We're really going to focus in on the metoprolol, diltiazem, captopril, digoxin, nitroglycerin, amiodarone, and losartan today. Now, the biggest thing with pharmacology is we want to just find those patterns. So with hypertension and heart failure, we're going to see some overlap in ACE diuretics, beta blockers. With heart failure and arrhythmia drugs, we have that overlap with digoxin, and then with the arrhythmia and angina drugs, we're going to have that overlap with the calcium channel blockers, or CCBs, as well as the beta blockers. In regards to antihypertensive medications, the blood pressure is going to be affected, whereas the heart rate is not affected in ACE inhibitors and ARBs. Just those two, ACE and ARBs. Now, the rest are going to have the blood pressure and heart rate affected. The CCBs, adrenergic blockers, vasodilators for pulmonary hypertension, as well as the diuretics. Our pril medications, the suffix ending in pril, ACE inhibitors, sartans, ARBs, dipine, calcium channel blockers, and LALs are the adrenergic blockers. So the pril, captopril, sartan, losartan, dipine, and lodipine, LAL, atenolol. Drugs that will be treating hypotension are going to be our adrenergic agonists. That's the dopamine, dobutamine, epinephrine, midodrine. And the hypertension treating drugs are going to be the ACE inhibitors, ARBs, calcium channel blockers, or CCBs, adrenergic blocker, vasodilators for pulmonary hypertension, as well as the diuretics. So let's really get into the meat of this. In regards to metoprolol or Lopressor, what is the drug classification? What must you assess prior to giving the medication? When do you hold this medication? Why is it used cautiously with asthma, COPD, etc.? What is a patient safety concern you should educate your patients about? A lot of these are really going to focus in on the same thing. Now, for metoprolol, that's going to be a beta blocker, BB. We need to assess the blood pressure and heart rate prior to administration. So let's remember, the only ones that are only going to affect the blood pressure and not the heart rate is the ACE and ARBs. So captopril, capitan, or losartan, Cozar. ACEs and ARBs. So again, metoprolol is a beta blocker. We're assessing that heart rate, assessing the blood pressure prior to administration. We're going to hold the medication if the systolic blood pressure is less than 100 or if the heart rate is less than 60. And the medication is really blocking the patient's bronchodilation ability, which essentially is blocking the fight or flight response. So this is definitely a key component in our patient education. And then definitely be sure that they're aware they need to change positions slowly due to the risk of hypotension. We certainly don't want any falls. With diltiazem or cardizem, Cardia, a lot of these are going to be the same as that metoprolol. So what's the drug class? What's the indication? What must you assess prior to giving the medication? When do you hold this? What is a patient safety concern you need to be educating your patients about? So diltiazem, cardizem, is a calcium channel blocker, CCB. Indications include hypertension, angina, arrhythmia, and we need to assess the blood pressure and heart rate prior to administration. Hold if, again, blood pressure is less than 100 or if the heart rate is less than 60. And then make sure, again, that the patients know to change positions slowly due to that risk of hypotension. So a lot of this is going to be the same, but diltiazem is a calcium channel blocker, whereas metoprolol is a beta blocker. In regards to captopril or capitan, what is the drug class? What is the indication? What must you assess prior to giving the medication? What are some common adverse effects? What is a patient safety concern, again, that you should educate your patients about? Captopril or capitan is an angiotensin converting enzyme inhibitor or ACE inhibitor. So indications, hypertension. We're going to assess the blood pressure prior to administration because we only assess the blood pressure for the ACEs and ARBs. We're not really going to see that significant effect on the heart rate. So while we're getting vitals generally as nurses, it's not going to be our main concern for ACEs and ARBs. So for captopril or an ACE inhibitor, again, we're checking the blood pressure. It's for hypertension. Adverse effects include hypotension, cough, and hyperkalemia. Too much potassium. And then patient safety education, change position slowly due to the risk of hypotension. Pretty common with all of these. Now let's discuss digoxin or Lanoxin. What is the drug class? What's the indication? What must you assess prior to giving the medication? When do you hold this medication? What are signs of toxicity? And what is the therapeutic range? Because it is a narrow range. So digoxin, Lanoxin, is a cardiac glycoside inotropic, and indications are heart failure because it helps squeeze the heart. We need to assess the apical pulse for 1 full minute prior to medication administration. Hold if the apical pulse is less than 60 beats per minute, or if signs or symptoms of digoxin toxicity appear. Those signs may be the yellow-green halos that we're seeing with the eyes, or nausea or vomiting. So if the patient's reporting visual changes and seeing the yellow-green halos, definitely hold the medication. Or if they're having the nausea vomiting in combination as well. Now the therapeutic range is going to be 0.5 to 2.0 nanograms per mil. Nitroglycerin or nitrostat. What's the drug class? What's the action? What must you assess prior to giving the medication? How is this medication administered? What should you monitor for after administering? What is a patient safety concern you should educate your patients about? What drug interaction prevents administration due to the risk of significant hypotension? So, this nitroglycerin is an antianginal or nitrate. The action is vasodilation of the coronary arteries. We need to assess the blood pressure prior to administration. Ensure the patient is sitting or laying down prior to administration. And then monitor for chest pain relief, hypotension or headache. Patient safety or education. Make sure to change positions slowly due to that risk of hypotension. Also, just make sure they're sitting or laying down, just because you can have that significant hypotension, and that can be pretty sudden. Now, in regards to a drug-drug interaction, especially causing that severe hypotension, you cannot take this if you've taken Viagra or other ED drugs. Let's talk about amiodarone or ocodarone. What's the drug class? What must you assess prior to giving the medication? What adverse effects should be monitored after medication administration? And what medications are commonly prescribed if a patient has AFib? So, amiodarone is an antiarrhythmic drug. We need to assess the blood pressure and the heart rate prior to administration. Monitor effects, such as further arrhythmias. That's going to be a key adverse effect. And then commonly prescribed medications if a patient has AFib is going to be an antiarrhythmic drug and an anticoagulation drug. So amiodarone and heparin or warfarin, etc. But it's usually going to be that combination of the antiarrhythmic and anticoagulant. Let's talk about losartan or Cozar. What is the drug classification? What is the indication? What must you assess prior to giving the medication? When is this medication commonly prescribed? What is a patient safety concern you should educate your patients about? So, losartan or Cozar is an ARB drug, angiotensin receptor blocker. Indication is hypertension. We need to assess the blood pressure prior to medication administration. Why not the heart rate? Because ACEs and ARBs are only going to be affecting that blood pressure. Now, losartan is commonly prescribed if a patient does not tolerate an ACE inhibitor, and that's usually going to be because of that coughing. And then patient education, change positions slowly due to the risk of hypotension. Essentially, pretty much all of these is going to be that same thing.